Good afternoon, everyone, and welcome. I am Marcy Fessler, Board President of the First Friday Club. In the name of our officers, board members, and committees, I am thrilled to welcome you to the first program of our 20th anniversary season. So please be sure to take a brochure with you. I know we have some scattered on the tables. We have a wonderful list of speakers. And take note, this is exciting. We are bringing back our dinner presentation in May. So make sure you mark that one on the calendar. Don't come in the morning. You're going to come in the evening and you're going to get a nice dinner. I cannot express in words my gratitude for the generosity of all those who have sponsored our speakers this season. Additionally, I am humbled by the support of our parishes who sponsor tables for their parishioners. So I ask, please take my gratitude home and share that with your pastors for their continued support of First Friday Club. We are eternally grateful. So in addition to the well-known and highly respected Dr. Kravec, our programming committee was able to book some wonderful national presenters. However, this means we have some additional travel expenses this season. So, if by chance you are able to help defray some of these additional expenses, I would ask that you prayerfully consider and then use the envelope that's on the tables. Somebody wave an envelope for me. I forgot mine. See, there we go. Mark it accordingly, and you can give it to one of the board members. We all have our name tags on. Or, mail it to our P.O. box. And if you have any questions, just ask one of the board members. So I thank you in advance for your help and for your ongoing support and generosity. At this time, please check your phones, check your watches, make sure they're silenced. Make sure your message notifications are silenced too. Because, it's so distracting when our phones go off. So please just take a moment and check those. As a reminder, if anyone needs religious education certification hours, please sign the form that was at the welcome table. There are no additional brochures on the table, but I do have extras if you do need one. But we also have our mail-in list. So if you have not signed up for our email, once a month, that's it. Once a month, we don't do anything else with it. Please join our email list. And we also have our flyer for next month. For more information about our programs, like us on Facebook. We post regularly on there. And if by chance you have missed a presentation or wish you would have taken notes, you need to subscribe to our YouTube channel. And you can check out the website for links to our videos on YouTube. So everything is there for your pleasure. So is Sister Rose here? Is there a Sister Rose? Sister Rose, somebody told me that today's a special day for you. I believe it's your birthday. So happy birthday, Sister Rose. So as a reminder, reservations are due the Thursday, so 1 week prior to the luncheons. Although, as my grandmother's always said, there's always room for one more, and we always make adjustments. But if you could get it a week early, that would be awesome. Join me in thanking Joe and Mary Ellen Brannigan for sponsoring Dr. Kravec today. Thank you. Yes. They always look at me like, why are you saying our names? So next month, we're going to gather on October 2nd to hear reflections from Bishop Bonner. Make sure you get your reservations in early for that one. I'm personally pulling that he's going to talk about his letter on the Sacred Heart. Has everybody read that? If not, it's on the diocesan website. It's amazing. So that's what I'm hoping he's going to talk about. Dr. Kravec will entertain questions in the last few minutes of his presentation. Okay. And before I introduce Barb Zorn, let's bow our heads, remembering our presenter, Dr. Kravec, all who have gathered here today, those who are unable to join us, and the friends of First Friday Club. In a spirit of praise and thanks we say, God, our Creator, you sustain our lives through the gift of your Spirit and the following of Jesus. Stir in us the desire to learn, to love, to serve more generously, to act on behalf of justice and truth. We ask these blessings in your holy name. Amen. Barb?
Thanks, Marcy. Dr. Kravec serves as Chief Clinical Officer for Mercy Health's Lorraine and Youngstown markets, leading over 2,000 physicians and clinicians across 5 hospitals, 2 medical groups, and affiliated networks. He also serves as System Medical Director for Graduate Medical Education, overseeing 600 residents across 7 markets. It's amazing to me that he can be here today. Thank you. Thank you, Doctor. A Youngstown native and a Cardinal Mooney grad, Dr. Kravec earned his MD from Neomed and completed his internal medicine residency at Summa Health. He's board certified in internal medicine and in hospice and palliative care. Dr. Kravec is currently pursuing an MBA at Youngstown State. Since joining Mercy Health in 2005, he has held numerous leadership roles, including president of Mercy Health Physicians Youngstown. He also serves as medical director for the Mahoning County Department of Public Health. And I know that his comments and presence were so important to my family during the dark days of the pandemic. So, Jim, we really appreciate that. Dr. Kravec has received multiple alumni and healthcare leadership awards. He lives in Canfield with his wife, Dr. Cynthia Kravec, and their 4 children. I know Dr. Kravec as a champion member of the Cardinal Mooney speech and debate team in days gone by, and also as a recently inducted associate of the Sisters of Humility of Mary. I give you Dr. James Kravec.
Thank you. Am I on? Good afternoon. Am I on? Let's try this again. Can you hear me okay? Oh. Yeah, well, I get it. Try it again. Okay, better? All right, very good. All right, well, thank you, Barb, for the introduction, and thank you to the Brannigan family for having me here today as well. So thank you for that. So when we went through the program, I think the title was Catholic Healthcare and the Ethical and Religious Directives. But you can see I changed the title a little bit to What Makes Catholic Healthcare Catholic? Because I think that's really the question that I was trying to answer when I put the title together a few months ago. Specifically the ethical and religious directives, which we'll talk about. That is part of it. But there's as I was going through this, there's so many other areas that make Catholic healthcare different. It's not just the ethical or religious directives. So, Barb, thank you for the introduction. I put this slide up because I haven't been to this program for several years, and I was asked to give a little bit background of myself. So I put a few things up here. This is really about me, the places I've went to school, and my family, and the schools I went to where my kids go, places I've trained, some of the work I've done during COVID and with the train disaster in East Palestine a couple of years ago. So I've been blessed with some great schooling and opportunities to places to work, and then really. This is my family pictures, which I think are fun to go through, and I think I see Father Eisworth. This is my Sarah here. I think this was your mass that she was sitting through mass, and this was at church. I don't think you were there, but this was at mass. This is my Maria, who's eating an Oreo for breakfast, I think. Michael's sitting on a Bud Light box. But this is my favorite. This is Jim many years ago, and this is when he was at the cathedral, and then Bishop Murray gave him his mitre and staff to wear, and so he's wearing that. So there was a few ladies said, and they were whispering, and Bishop Murray said, "Do you want to try this on?" And Jim did. So he's standing there with the mitre and staff on, and the women said, he can't do that," and Bishop Murray said, "They're mine. I can do what I want with them." So that was the story. So Jim's not going to be a priest, I don't think, but that's him dressed as a bishop. So the overview of what makes Catholic healthcare Catholic, and really I've divided it into several different categories, and really an overview of Catholic healthcare in the United States, Catholic healthcare in the Mahoning Valley, what a mission statement is and how that might relate to hospitals and healthcare. What Catholic identity means, specifically in healthcare. Looking at something that we work on in our health system at Mercy Health is called the discernment process. And then finally, the last piece is on the ethical and religious directives. That could take 10 hours of talking because there's so much to that. So I put that at the end to see what we get to, and we'll have a few examples of this. I'd like to thank our Vice President of Mission, Jim Armour, who's over here. Jim has helped me, including about a half hour ago, when I said, please explain this one piece to me again, because this is so complicated when it comes to understanding the deep details of ethical and religious directives. But we know them because it's what we do, and it's what separates us. So that's really what makes Catholic healthcare Catholic. But what is Catholic healthcare? Catholic healthcare was founded based on the work of Jesus himself many years ago by healing, the ministry of public healing. This is a picture that we show quite a bit where Jesus is healing someone in the crowd, and there was so many people visiting that people had to lower someone sick through the roof to get to him. And that's the picture that we show all the time in a lot of the meetings and gatherings that we have to show that Jesus was the healer, the first healer, and this is kind of the roots of Catholic healthcare. The first Catholic hospital in the United States was in New Orleans, Charity Hospital in 1787, so many, many years ago. And Catholic hospitals then, but also now, do focus on the poor, do focus on those in bigger cities where there's a lot of opportunity to help people. Most Catholic hospitals were started by religious orders, and as ours locally was. In 1990, and this is still true today, the Catholic Church is the largest provider of healthcare. It flipped in 1990, the largest provider of healthcare as an entity in the United States, and 1 in 6 hospitals, beginning in 1990, that number stays about the same now. 1 in 6 hospitals in the United States are Catholic. So that's a large amount of care provided in the United States by the Catholic Church and in Catholic hospitals. So this is going to, I wasn't sure how big I was going to have, so this next is going to be hard, but let me read this to you. This is a 2023 data, so it's a little bit dated now. It's the most recent one that's published. This is the 25 largest health systems in the United States ranked by beds, essentially, the number of hospital beds that we have. And you could see of these top 25 systems, there are a total, I think it's 7. There's 7 that are Catholic in this of the list, 7 of the top 25. So you can see that Mercy here is number 13, Bon Secours Mercy Health, we have 34 acute care hospitals and about 6,000 staff beds in the United States. This is in the United States, because we have hospitals elsewhere in Ireland. It starts with Common Spirit and Ascension, big systems in California and in Chicago area. And then you see, looking down the other systems in the community, Cleveland Clinic is number 21, and there's others that are down there. So we're number 13 in the United States, the fifth largest Catholic system, and the 13th largest system in the United States. So with that comes a lot of infrastructure that we have to support each other. And as I tell the story about the size of us, I go back to, Barb mentioned the COVID days in the beginning, and I remember very, very vividly, it was a Saturday morning in March, it was April of 2020, and we received a call that the number of ventilators was one left over between St. Joseph, St. Elizabeth, and St. Elizabeth Boardman. We had one ventilator left because so many patients were getting sick so quickly. And all of our neighboring hospitals had nothing left as well. So we have a hospital. I'll show a slide. Actually, I think it's, we have hospitals in Greenville, South Carolina. So it's about a 12-hour drive away. And we made a call on a Saturday morning and said, we have one ventilator. Well, if you remember COVID, we had a lot of COVID in early April. South Carolina had hardly nothing. And so they put 15 ventilators in a white box truck and shipped them up, or drove them up to us. And one of their staff members got in a truck and drove them up. About like 8 p.m., we had 15 more ventilators that we were able to have. And that was the most clear advantage of the system that we have. And then 3 months later, in June, when our COVID had dropped to a very manageable level, we drove those 15 back, plus about 15 of ours, to Greenville when they were having crisis. So that's kind of some of the stuff that we do, and that's why these numbers are just, rather than just being impressive in size, they're actually really meaningful to how we operate. And this is true. The work that I do, the work that Jim does in Mission, we share feedback with each other and we share stories, and that's what we do in this kind of work. So the healthcare here in the Mahoning Valley was really, we have several tables of the Sisters of the Humility of Mary here, and it was founded here in the valley, and you can see these. I took these slides from one of the slide decks that the sisters put together about the history of healthcare in the Mahoning Valley, and these are some of the very first areas where, this is on the Villa Maria campus. This was the first hospital area, the first healthcare area, and these slides are just representation of the work that were done by the sisters many, many years ago when it was called St. Joseph on the Villa campus. So this is really the timeline. The sisters came from France to Villa Maria, to America, and created the Villa Maria area in 1864, so many, many years ago. And as things evolved, the first hospital in Youngstown was at St. Elizabeth Youngstown Hospital on Belmont Avenue. That was in 1911. St. Joseph Warren Hospital, there's been several buildings in the meantime, but that entity was created in 1925. And then just up the street here, St. Elizabeth Boardman on Market Street in 2007, so much later. So those are the three hospitals we have in our community now, and that's really a little bit of the history of them. But the foundresses really are the Sisters of the Humility of Mary, some of whom are still in our hospitals as volunteers. And I remember Sister Margaret Mary is here. And I started working with Mercy in 2005. And you remember the story because she told me that she remembered about a year ago. My first office was in the former convent. It no longer stands. And I remember sitting in the office, and I went in my office. I opened the closet. There was actually a little shoe rack still that was in there. And she came in to visit and tour the building and said that she told me every room was still, what part of the convent was the kitchen and the sitting room and whatnot. But that's the kind of history that we still have. Now that building isn't there anymore, but that we were part of that, and that is the history that we have from the sisters then and now. So back to where we are with Bon Secours Mercy Health, we are, again, the fifth largest system. We have 1,200 sites of care in the United States. So there's a total of 50 hospitals, 45 here in America and 5 in Ireland. More expansion will be coming. $500 million in community benefit. So what is community benefit? Well, that's a system number. Our number here in the Mahoning Valley is $80.8 million in 2024. So that's money that should be profit for a hospital system. But Catholic healthcare has what we call community benefit. So those are patients that we can't bill or services that we give away to the community or to patients that is not billable because that's not what our mission is. We're not a for-profit company. We're a not-for-profit Catholic healthcare entity. So that $81 million here in the Mahoning Valley of care that we give, and that's every year that we give to our community in the form of health care that's not reimbursed, or community programs where we send people out in the community, or things we do in our churches and our schools and whatnot. And so that's something that will continue to grow as there's more need. So that's just an interesting fact that we have. And so, we have 200,000 lives impacted annually by our global ministries. We have missions in Peru, in Haiti, and in Africa now, where we send people, and we have resident physicians go for training, and we send supplies. And so it really is a global mission that we have. Locally, we have our sites here. This is just a map, and the specific areas aren't important, but really we have offices and hospitals in the three-county area from Sebring, far west side of Mahoning County, down to East Palestine, up to Cortland and Champion. So really that's our wide area of where we have our physicians, where we have our hospitals, and all of them is giving the Catholic healthcare that we have. And last year we had 920,000 visits in our medical group practices. So it's a very robust system that we have providing the care that we're talking about here. With our 32 primary care offices, and this year alone we're adding 2 more to get to 34, and 1 more in 26. So those kind of areas is how we advance the mission of what we do by expanding our access to care. I was asked a question earlier about patients that don't have insurance, and how can we assure that they're given access. And the reality is, all of these sites, if I go back, all of these sites on this map, it doesn't matter if you're in just an inner city Youngstown or Warren. If you don't have insurance, it doesn't matter. You don't have to go right to the inner city clinic. Any of these offices, our North Lima office is a mile down the road that way, and you could be seen no matter what the insurance you have, no matter what, anything. And that's how it works as far as the care that we give, and very, very proud of that. So what is a mission statement? I'm going to pivot a little bit. What is a mission statement? A mission statement, and this is just taken right off of the definition from a dictionary. It's a concise declaration. This is in general, not just about Catholic healthcare. And mission statement in general, why an organization exists, what it does, who it serves, the values. It acts as its guiding principle for that organization. If anyone has a business, you create a mission statement about what you do and what you want to do. Outlines the organization's purpose and daily operations. That's what a mission statement does. So I pulled a couple of mission statements. I think this is important to go through. So this is a mission statement of a hospital. I'm going to read it, so it might be hard to read. As one of America's top-ranked academic medical centers, our mission is to improve health in Ohio and across the world through innovations and transformation in research, patient care, and community engagement. That's good. Another one, to serve our communities by providing outstanding patient care, shaping tomorrow's health system through clinical and technological innovation, research, and education. So these are, I'm not going to read the last one, but they're all good. They're all good hospital systems that are all good mission statements. Those make sense. So the first one is Ohio State. The next one is University of Pittsburgh. The last one is Metro Health System. They're all good systems with good care, and those mission statements are great. Okay, here's 2 more I found. This one's, notice the difference. We serve together in the spirit of the gospel as a compassionate and transforming healing presence within our communities. Or, through our exceptional health care services, we reveal the healing presence of God. So what are those? Well, one is Mount Carmel in Columbus, and one is a health system called SSM Health in St. Louis. Those are the 2 systems I found. They're both Catholic. They're random ones I picked. But you see the difference, right? Neither one's right or wrong. So what's my point of this? As we go up the street to St. Elizabeth, or if I go to the primary care office in North Lima, a mile down the road, I hope you get excellent medical care with medical treatments and technology and patient experience from the nurses and staff and doctors. I hope you also get that if you go to Ohio State or UPMC, and I think you do. But what's different? And the difference is what I'm going to talk about as far as the mission that you see on these last two versus the mission in the first two. It's just a different focus with Catholic healthcare. So this is our mission statement. So Bon Secours Mercy Health extends the compassionate ministry of Jesus by improving the health and well-being of our community and bring good help to those in need. And the last part's important, especially people who are poor, dying, and underserved. And that really goes back to the gospel that we learned about in the foundresses with the Humility of Mary Sisters and the Bon Secours Sisters and the Sisters of Mercy, our three founding groups that formed our company. And they put the three groups of women put this statement together about 7 or 8 years ago because they gathered the best things of all three organizations when they came together, when they formed us. So those are just some examples I wanted to share because I think that hopefully paints a picture of what's different. Again, most hospitals, because we're opened by we're judged by the Joint Commission and other standards. We have to meet minimum standards of care, minimum standards of safety. We all do, for the most part. Almost every hospital in America does the same thing, but what separates us? Our mission and also our values. So these are the 5 areas that we talk about. We talk about our values, and this is what drives us every day as well. Human dignity, integrity, compassion, stewardship, and service. So those 5 words are really what we have. We start off most of our meetings with either reading the mission statement or having the values on a slide or talked about, and that's just something that I know that's different. When I worked in hospitals that were not Catholic hospitals, again, good care, but this is what makes it different, and that's an important piece I think that we think about. So what is exactly Catholic identity? So Catholic identity is, first of all, I don't think, and probably there's several people here that work at Mercy Health. We don't really call it a company or a business. I think other places might. It's our company we work for, or it's our business. Almost everybody. I was with someone last night who's a person that takes registrar. She registers people when they come in to sign up for X-rays at St. Elizabeth, and she even used this word. So we're getting our word out to everybody. She said, "I work for the ministry as well." So the word is ministry. So it's not a company or a business. And people call that. If you talk to people that work at Mercy, they typically will say that, and it's not forced. It's something we've learned. So I think that's important, and it's just a different focus of things. We have a mission department, we have spiritual care departments, we have pastoral care, and a lot of the folks are here today. And that, many hospitals, even non-Catholic hospitals, may have some departments of pastoral care and whatnot, but it's different. It's really a different part of what we do, and it's very much ingrained helping the person. If you have a heart attack, if you have an infection, if you have a stroke, you're going to get better with medicines, hopefully, or technology. But having the focus on spiritual care and pastoral care really does accelerate the healing process. And so, again, the folks that do that work really understand that and help us as we help with the identity of Catholicism and make it's part of the work that we do. So what are some other examples, some case examples? Bishop Bonner tells this story, and he gave permission yesterday for me to share this story. He was sitting in a hospital about getting a minor procedure for himself a couple of years ago. And he looked up and about to have a little procedure, but he looked up at the wall, and there was the crucifix. So it's the cross of the risen Jesus is on the wall at St. Elizabeth in Youngstown where he was. And if you've been there, you notice every patient room and in the hospitals have those on the wall. And he saw that picture, or the cross, the crucifix, and he said it was very calming to him. He was anxious about his medical test he was going to have, and he looked up and saw that, and he felt calm. Had his procedure, everything was fine. And I ended up talking to him a little bit later in one of our medical practices. And he was talking, he said, I was in a medical practice, and there was no symbolism like I had in the office. In the hospital. No symbolism in that medical practice. So I talked to my friend Jim over here, and I said, I said, we need to order some crucifix. He goes, how many? I said, 673 was the number. So there's a box in Jim's office with 673 crucifix, and I think they're almost all up now. So because of that suggestion, that we now have crucifix or the risen Jesus in every exam room. If they're not up there, they will be soon. but they're all ordered. In our waiting rooms, we're going to have real big ones, big cross as well, which I think it's a symbol, right? It shows that we follow our mission statement, our Catholic identity. That's very, very important. We start our meetings with, almost every meeting we have, with a daily prayer. We start at 9 o'clock in our hospitals over the loudspeaker. If you've been there, they start with a daily prayer as well. One of our chaplains or spiritual care leaders or pastoral care leaders will read a prayer. And so that's so calming to the staff. And usually everyone stops for the 30 seconds and listens and moves on. So that's just a little bit of what separates us. And I think that's really important because it really is meaningful. And if you go, next time you go into one of our practices, if it's not up yet, take a look for the picture here. They look just like this. It's not a traditional crucifix, it's the risen Jesus, which is really just a symbol of the healing and next life. So what is discernment? Have you guys heard that word, discernment? Well, discernment really is a process. It's an intentional awareness. It's a process of being aware and open to the guidance of the Holy Spirit in the work that we do, the relationships that we have, and the decisions we make. So it's a process of making a decision. I think we can have a conversation and say, we have to do this or this. What do you want to do? Let's do that. That's a decision making. That's just making a decision. That's making a choice. What is discernment? Well, it's a formal process. And this is something relatively new. It's not new in the creation of the word, but it's something we've been doing within Mercy Health. And there's really 7 steps of discernment. And so I think as we go through this, we agree on the issue. I'll give an example in a minute. We agree on the question, agree on the problem. Who are the stakeholders? Who should be having this conversation? What are the facts? What are the values and concerns? Okay, you have all that. What are your options? Should we do A, B, or C? Well, then we stop. And this is the different part. We've always, that rest of that stuff kind of makes sense. Then we stop for prayerful reflection. And that's the interesting part. We've been doing that recently, and we always have been, but we're very intentional in calling that out. What's the right answer? How would this fit into our Catholic identity? How would this fit into our mission? How would this fit into our values? And then we make the decision, discuss it, make a decision, and then explain. So I think that's really important, and it's something that we've been taught lately as an entire system, an entire ministry has done this. But locally, we've adopted this about 3 or 4 months ago where we've started talking about this, and we're very intentional in making these decisions. So what are some examples? You may have seen the news about 2 weeks ago. We opened up a new emergency department in Champion. Well, we broke ground, I should say. We'll open it up at the end of 2026. And we talked about that. Where should we do it at all? Should we grow? How do we handle a closing of Trumbull Hospital? Do we work in that building? Do we build something new? Do we add new staff? All those questions. Who are the right people? Let's think about it. That's easy. Just talk about it. But with our mission leaders, how do we make a decision? What's the right answer for the community? What about new technology? When we spend $6 or $7 million for machinery. Healthcare is very expensive. So if we're going to do that, where do we put the machinery? What do we buy? What do we need? Right? There's science behind that, but there's also thought process and prayerful reflection that we did. What about partners? We're going to talk about partners in a minute, but who are our partners? Are they like companies or like mission statements? How do we discern? So I think that's an important concrete example that we do. Almost every meeting that we have about Catholic healthcare is the prayerful reflection. The 6th example on this. So lastly, my last area, and this is on Catholic ethical and religious directives. What are those? Well, they're established by the U.S. Conference of Catholic Bishops. And so that's who creates them for us. They're guidelines for Catholic healthcare facilities. They provide a theological basis for healthcare services. And they assure that all the work that we do in our practices and our surgery centers and our hospitals align with Catholic moral teaching and principles. We are a Catholic entity, and so you can't sway. We have to stay within the guidelines. They focus on a lot of areas, sanctity of human life, dignity of persons. So those are the areas. They focus on our employment practices, making sure that what we have is just and right for our employees as well. So that's really an interesting area. So what are some of the areas? Well, there are 6 parts and a general introduction. So that's what we have. That's how they're divided. We're just getting a new set of these. These get updated every 5 or 7 years or so with new versions of these. So the first part is the general introduction, which explains the basic reason for healthcare. I'm going to go through each of these. So who should we be? The reason we are Catholic healthcare. God's life-giving gift and healing work. We imitate Jesus' service. That was the first slide I had, is what is Catholic healthcare? We do the work of Jesus by imitating his service to the sick, suffering, and dying. And we are a ministry of the Catholic Church, internationally, nationally, but locally as well. You know, we meet very regularly with Bishop Honor, and as we have updates and good things and bad things and problems and crises, we update our leadership, our board, and our bishop very regularly. And that's important. You know, we really much are a very local church entity, not owned by, but very much a part of the Catholic Church locally. And so that's very, very important that we keep that connection to the bishop and keep that connection. And that's true in all the areas we work. I also work in the Cleveland Diocese, and we meet with the Cleveland bishop as well very regularly and update him on issues that we have. And it ties things back and forth. So part 1 is on social responsibility. So that's how it's called out. And the common values, and these very much, not exactly, but very much tied to the values that we have. So our values of dignity, human dignity, care for the poor, contribution to the common good, stewardship of resources, and connectivity with the church teaching, making sure it's all connected. So those are very important. That's the core guidelines of what we do, keeping it very, very tied to the Catholic Church and through these guidelines. Part 2 is on pastoral and spiritual responsibility. So I talked about that already. And you know, some people who know a little bit about the Catholic ethical and religious directives say it's all about either pregnant women or dying patients. And there's a lot of that, because there's a lot of theoretically controversial areas. But this is equally as important. Focusing on pastoral care, focusing on spiritual health, having good relationships between the clinical staff, the nurses and the doctors, and our pastoral care teams and our social, spiritual care teams. So I think that's a really important part, and we do live that. Our teams that do that work really do feel that every day, and I hope there's a lot of support back and forth. I know there is. Next is on our professional-patient relationship. So this is really looking at the respect of human dignity. You know, if I think through what this means, as we work with our patients, one great example I want to talk about is advanced directives. And, you know, patients that are, as patients get older, do you want to have life support? Do you want to have CPR? What wishes do you have? That's very, very important. We have an initiative in our practices, talking to our patients very early, making sure that's documented. It's easy to document it when you're not sick, but when you're sick in the emergency room, it's harder to have those conversations. Maybe you're not awake for it or whatnot. So we try to do that in our practices. So that's a great example of looking at the professional-patient relationship and how we can connect those together. You know, part 4 is on care for the beginning of life. So the Catholic healthcare ministry focuses on the sanctity of human life, and the exact terminology is from the moment of conception until death. And so that is the focus that we have. Includes care of women and children before and after pregnancy. It also addresses things such as inadequacy of care, making sure that we have enough care for the pregnant women and care for the children, and that's very, very important. So what does that mean? Well, I know many times people will say, well, that means you can't do this, or you shouldn't prescribe this, or with direct abortion is certainly something that's certainly not happening in Catholic hospitals. But but let's talk about a case. So a case is a young woman that comes in who's pregnant and is found to have an ectopic pregnancy. That means the pregnancy is in the wrong spot. It's in the fallopian tube rather than the baby is not going to live, but it still is it still is present. Okay, so it's a current pregnancy, but it's not in the right spot in the woman. And so that could, if that ruptures, or as it grows over time, the woman would die if nothing happened. So that someone might say, well, how do you handle that? We're not allowed to remove that because that's killing the unborn child. But the double effect is, the theory of double effect is the mother will die and the baby is going to die too because it's not a viable pregnancy. So that's something that this allows us to take the fallopian tube from the woman so she doesn't die, because the baby is not going to survive on its own because it can't grow in that environment. So that's something that if we say something, there's no such thing as almost the black and white. There's very much case examples that we go through. Let's talk about the part 5, which is care for the serious, ill, and the dying. So I think a lot of this could go on for a lot of questions on this too, because I think it's very, very important. I used to work at the hospice house, and this came up quite a bit with questions I would receive about relief of pain. How do we work with medicine at the end of life? When do we stop medicine? When do we stop nutrition? And on palliative care and hospice and all those type of areas. So let me go through some examples. So what about foregoing treatment? Someone doesn't want, or a person, people say, well, you can't not get that chemotherapy, or you can't not have that surgery, or you need to continue with dialysis, because that's what the church says. We hear that a lot. I know that the mission leaders and the spiritual care leaders probably hear that more than I do even. The church says we must do everything forever, type thing. Maybe I'm paraphrasing. But we look at the extraordinary and disproportionate means of preserving life. So if someone has cancer and has end-stage cancer and it's not getting any better, or if someone has kidney disease and can't tolerate even the dialysis anymore, stopping those treatments is compassionate care. It's not against the Catholic ethical and religious directives, because it doesn't make sense it's extraordinary and it's disproportionate. So in the patient's judgment, with the help of their clinicians, it does not offer reasonable hope or benefit. So that means that decision is made with looking at the entire picture. What's another example, right? Well, this is on euthanasia. The question could be asked, is withdrawing or withholding medical treatment euthanasia, right? Well, the answer is no, and because treatment is based on cure and outcome, right? So what can you cure? Well, if it's not curable, it's okay to stop that treatment. Or if your care is not going to change the outcome of what you're doing, your medicine's not going to help, your chemotherapy is not going to help, your nutrition is not going to help, then you don't need to continue it. It's not against what the church teaches or what Catholic healthcare teaches, because it's not going to have a positive outcome. So I think that's important as we think through that. What about artificial nutrition hydration? So this question was an exact question that came up to me when I worked in hospice. A patient was at the hospice house. They were not alive. About 3 months prior, they had a feeding tube put in, because they were still functioning at that point, and they were getting feeding tube put in. But they were no longer awake, but they didn't want to stop that feeding tube, because they said, we can't not feed my loved one. But the person, we've already made the decision, the family already decided, the doctors already decided the patient was in hospice, they were within days of dying. But they said, but we have this way to feed. I said, well, they wouldn't be eating normally because they're not awake. Well, no, they wouldn't, but I have this area to feed them in. Well, that doesn't work. It's to think about the artificial nutrition hydration, and what happens. What's the purpose of this? Well, the purpose is, or not the purpose, but the outcome. You're probably going to cause more harm by artificially feeding someone whose body says, I can't eat right now. So they were worried about going against the church teaching of withholding treatment, but the answer is the ethical and religious directives don't call that out. They don't say that's bad. They say that, when it is not indicated and it does more harm than good, you don't have to continue that. Okay? What about pain management? Because this comes up a lot too. And this comes up when I worked at hospice. I don't do that work anymore, but it came up quite a bit with pain management. So a primary purpose of medicine and caring for the dying, and this is under the last part of the section 5 of the ERDs is the end of life, is relief of pain and suffering caused by pain. So effective management of pain in all forms is critical. We must do that. Now, we don't want to give pain medicine when someone doesn't need it, but we want to give pain medicine to relieve their suffering. I have three little white pills here, and this is an absolute true story, and it probably happened. I worked at the hospice house for 7 years. It probably happened 15 times, and it's not an exaggeration, where I would see a patient who was a loved one of someone, and someone would follow me out of the room and say, and very, very sincere, I don't think any bad was happening, but they said, doctor, isn't there a little white pill you can give them just to speed this up and hurt because they're in so much pain? And the answer is no, we can't do that. What was the intent is not to kill somebody because they're dying. However, we can treat their pain, and we should treat their pain very aggressively if they're in pain. Now, when you do that, sometimes they die because of it, because you're treating their pain. What's the intent of what you're doing? It's not to kill somebody. That's bad. We can't do that. We can treat their pain, and by treating their pain, they might die. Outcome's the same, but does that make sense? You understand the theory of why you're doing it. So that's probably, in my mind, one of these last two, on the artificial nutrition, hydration, and on pain management. Those are the two examples that came to me all the time when you care for patients. And going back to what the Catholic ethical and religious directives say, what we did by withholding IV fluids and tube feeds when someone's dying, that's okay, and we should withhold. And when you treat pain, even if it means someone may stop breathing because of it, that's okay. We should do that. So those are areas that you feel very comfortable in looking at that. So we can go on this part forever. Part 6 is on collaborating arrangements with other healthcare entities. This is very interesting too. As healthcare gets more complicated, we talked about how big Bon Secours Mercy Health is. We do different business deals. Up on Belmont Avenue in Liberty, there's 2 brand new hospitals. One's open and one is opening soon. Those are owned, they say Mercy Health on the door, but they're actually half owned by Mercy Health, half owned by a company called LifePoint Health, which is a for-profit company that is based in Tennessee that's not a Catholic hospital. It's a hospital. It's a good hospital, but it's not a Catholic hospital. However, when we form partnerships with these hospitals, in order for us to work with them, they must sign on in a contractual form that they're going to follow the Catholic ethical and religious directives. They're a non-Catholic hospital, but for us to work with them, they must sign up for that. Interesting. We've had the same experience in our hospice and home care. As we partner with other companies, they don't become a Catholic hospital. They don't become a Catholic half of their company, but they follow these rules, and they must in a contractual form. So as we collaborate more and more, that's interesting. That's how we're going to have to do that, because it makes sense and it keeps our Catholic identity in the work we do. So really, that's the wrap-up of what I have. I think we went through the overview and nationally, locally, what it means for a mission statement, Catholic identity, and then the last 2 things were discernment and on ethical and religious directives. So I'm happy to open any questions or answer any questions you may have. I think Mary Ellen has a microphone.
Thank you very much, Dr. Kravec. It was very enlightening. I have a question. It might be in 2 parts. First of all, you talk about the dignity of human person, et cetera, as the core value of Catholic healthcare. And then also, in the last section, you talked about cooperation of various health entities. So, in the news, there is, the CDC that is in turmoil, et cetera, and, various directives that have come from, Washington. Mm-hmm. So what is Catholic healthcare response? to those?
Yeah, so very interesting. A lot of this, even the prime example, even more than the CDC, is what happens if ICE comes into our practices, into our hospitals, and it's interesting. So we have to follow the law too. So the answer is both. The answer is we work with following federal law, but we also have to maintain dignity and compassion, and also have a response back. So working with CDC, for example, we're working on our own vaccine rules and guidelines and whatnot, for example, but also realizing that we still do have to follow federal law, because most of the money we receive does come from Medicare and Medicaid, and so it's a balance of both, but we still maintain the fact that we respect the dignity of people and we follow our policy, which I think, and I'm very comfortable with our policy of how it's written to protect patients who are in our care, and I think that's an important piece of it.
One comment about the recent shooting at Annunciation. One of the children that was brought to the emergency room asked for prayer, and the entire surgical team that was treating him did pray with him, and he did very well, and they did better too. So prayer necessarily has to be a part of Catholic. I wondered about the Catholic Health Association. Does it still exist? And what is the relationship of Catholic hospitals to the Catholic Health Association?
So go ahead.
Yeah, is it still in existence?
It still exists, and I believe we have some board members. Two of our executives are board members of the Catholic Health Association, and so we do. We're Bon Secours Mercy Health. I believe it's our CEO and also our chief people officer are the two executives on that board. So we do work with them. We're still our own company, but they still do represent as well.
My husband was in hospice, and the nurse came and asked me if she could stop giving him all medication so he would die faster, and I would not let her do it. I said, I'm not, it's in God's hands now. And they were quite upset that I did that, and he died 2 days later, but I didn't think that was right that they would ask something like that.
And I think a lot of that's, so the question was, can I stop his medicine so he dies fast? That's not, typically you wouldn't say that, but you would say, for example, when someone's actively dying or soon to be dying, typically we stop their cholesterol medicine that is meant to stop heart attacks within the next 10 years. Mm-hmm. Or we would stop their vitamins, or we stop if they have a catheter in, we stop their prostate medicine. So we do stop most medicines, not with the intent of someone dying quicker, but with the intent of every pill. What does that do? And if the intent's not to help them within the next 24 hours, we typically would stop that.
And this was his heart medication, and they wanted to stop that.
Yeah, you have to go medicine by medicine. So I would
Yeah.
say even heart medicine, some you stop, some you don't stop. It all depends on what
Yeah.
it's for.
Okay, thank you.
But it's not for the intent of someone to die quicker. It's what is the intent of that medicine? What does that do, and what will it do in the next day or two versus the next 10 years?
I just had a question. My mom, years ago, was dying of cancer, and you mentioned about stopping the nutrition, and I kind of wanted for myself too, because, end-of-life care for myself too. But I always thought, like when you get dehydrated and stuff, you feel so sick, and I just wondered why the reason you said it's better to stop the nutrition if you're sick.
Sure. So a lot of it's case by case. So my example was, if someone has the nutrition through a feeding tube and they're dying, your body conserves its blood flow to the brain or to the heart. That's it. It doesn't give blood flow to your gut. So if you put food in your gut, then all of a sudden it's either going to take blood flow away from the brain and heart to the gut, or it's not going to give it blood flow, and you're going to have a lot of pain and struggles processing that food. So that's one example. IV fluids, it's just different. Same thing. It depends. Every patient's different, but if you're actively dying, or if you're not able to process, if your kidneys are shut down and you're continuing to give IV fluids, then your kidneys will cause swelling, which causes pain. Now, if you're in cancer treatment or whatnot, and IV fluid is one of the most common things we should give. So it depends on where you're at in the stage of the process of treatment or of process of dying.
Oh, okay. All right, thanks.
I think we have time for one more.
I can.
Yeah, you mentioned the contractual agreement that you have with facilities that aren't necessarily driven by Catholic mission. And so I know that the ministry attempts to hire the best of the best. I mean, whether it be a respiratory therapist or a neurologist, it doesn't matter. So for persons who aren't necessarily people of faith, for lack of a better word, or Catholic for that matter, is the same kind of contractual arrangement made with individuals? I mean, as they're hired into the system.
Yeah, so we have, in the Youngstown area, we have about 6,000 people that work for us overall. We're the largest employer in our area, and most aren't Catholic. More than half aren't Catholic. Some have no religions, and many are not Catholic. They still have to follow the ethical and religious directives. If they work for us, they have to follow those. They may not personally, believe the Catholicism, but they have to work for us, they follow the ethical and religious directives. And we have the ethics committees review things as we have them. So the answer is yes, and they have to follow the mission too, right? The mission of caring for the poor and
So it's not necessarily by contract, but by what's expected of them.
it's what, yeah. So companies that we partner with have a contract, they must follow these. Our employees must follow them to be an employee.
Okay. And just one last thing. Many of those parameters are, they could be dignity of the human being, the autonomy of the person, et cetera, et cetera. Those could be they're secular as well as faith-based and faith-driven. So I guess I wondered, is there any kind of an onboarding process that I should know this? I don't. Is there an onboarding process that happens that where that kind of discussion may occur? These are the things you certainly might embrace, but remember who we are, kind of thing.
Yeah. Yeah, every new employee has an orientation period, and then we meet with our manager every 90 days or so, and so that is part of it. Within the orientation, or some of the leaders that are here do talk about that, and they talk about spiritual care, and they talk about the ERDs, the ethical and religious directives, they talk about our values and our mission. So there is a lot of education when you work there.
Right.
Yeah.
Thank you.
Sure.
Dr. Kravec, thank you. This was the best start for our 20th anniversary I think we could have ever planned. So wonderful. Thank you, thank you. Thank you all for being here. What a great day, other than the rain, but we need rain. I hope you all enjoyed today. Spread the word. We want to see these kind of numbers all season. And I look forward to seeing everyone October 2nd for our next luncheon. God bless and safe home, everyone.